Good evening, Commonwealth, and thanks for watching the Channel 2 News. I'm Ashley McDowell. Let's take a look at tonight's top stories. The CNMI has received confirmation of more COVID-19 cases. Also tonight, the CNMI is one step closer to testing for COVID-19 at CHCC. And PSS employees received a letter that will change the rest of this school year and possibly the next. Stay with us, these stories and more are next.
We are with you. At times when you need us most, you can count on us to be there. When you need someone to talk to. When you need to stay informed. When you need to brighten your day. When you need to stay connected. We are here keeping our promise that while the world is changing, we keep working so you can keep connecting. We are your Docomo Pacific family, and we are here to help.
Jose and Pedro were born on the very same day. Jose liked to play sports. Pedro liked to play video games. Jose's favorite word was pass. Pass me the ball. Pedro's favorite word was pass too. Pass me the rice. Jose is retired and has both time and energy. His life is just beginning. Pedro has diabetes, hypertension, and gout. His life could soon end. Eat less, play more, live longer. Brought to you by PHI, the pharmacy you can trust.
Off a day, Tirwami, and good evening, Commonwealth. Today is Wednesday, April 15th, 2020. The COVID-19 Task Force has announced more confirmed cases of COVID-19 in the CNMI. The COVID-19 Task Force, along with Governor Torres and the Commonwealth Healthcare Corporation, has announced 2 new confirmed cases of COVID-19 in the CNMI, bringing the total confirmed count to 13.
We've been working extremely hard with our CEO and the task force, our nurses and doctors, in stopping the spread or slowing down the spread. Every new case that comes in is a reminder that this coronavirus is still out there, and that none of us should take put our guards down. That we need to continue to practice mask, social distancing. And proper hygiene, and again, stay away from and respect our elders, and this is one way to remind everybody. Same thing again, and I'll remind everybody, the beach is open, pathway is open for individuals to do their exercise. When you continue to do groups, you're jeopardizing that opportunity and to go out to the community or out to the beach and pathway. So again, unfortunate that we do have 2 more cases, but we'll continue to move forward and making sure that we provide our health care that needs.
Both new COVID-19 cases were males, one being a 55-year-old and one 61-year-old. CHCC states both are in stable condition and are being monitored by CHCC medical teams, and says the cases are suggestive of community transmission within a cluster of linked cases and has initiated contact tracing. As of April 14th, 59 specimens have been submitted for COVID-19 testing. 55 have been processed, with 13 positive and 42 negative. CHCC is still waiting on the results of 4 specimens.
9 have already recovered, so we only have the 2 latest positives that are active, but 9 already has recovered. So this is showing that there's recovery, and we just need to continue to monitor them and make sure that they're doing well. So right now the 9 are doing well.
Munoz says the 9 that have recovered have been released from Kanoa Resort. The CNMI is one step closer to having available testing for COVID-19 at the Commonwealth Healthcare Corporation. Governor Ralph Torres announced late Monday evening the arrival of 20,000 COVID-19 test kits for the Marianas that have been purchased from South Korea. The delivery came via direct charter flight from South Korea and also brought a clinical pathologist to perform equipment calibration.
We want to test our community at 100%. As the hospital decides that who will be tested and how they will be tested. What I meant is that anybody that needs to be tested, that we are 100% ready for it, and that those test kits should avail to those that needs it. So I want to thank again Esther, her team, the nurses, doctors, our first responders, definitely the task force. Our challenges was definitely the transportation, but Patrick Gar was able to get that.
In total, the CNMI is set to receive 60,000 test kits, with the remaining 40,000 coming this weekend. The kits are the DIA Plex Q PCR novel coronavirus detection kit that comes from Solgent in South Korea. The CNMI funded the purchase and shipment of the test kits and will be reimbursed by FEMA.
These test kits that we got was local funding. We will be making those requests for reimbursement to FEMA.
CHCC CEO Esther Muña says there will be priority levels when it comes to the COVID-19 testing strategy.
The reason why we have the priority levels is to ensure, number one, 20,000 is not population based. So if we have 60,000, that's great. We can test everyone. At this point right now, because we only have 20,000, we want to make sure that we have a criteria to utilize it, especially for those that are critical in need, like the healthcare workers with symptoms, hospitalization with symptoms, and all that. So we wanted to make sure that those people get access to this immediately.
And with the Federal Emergency Management Agency, FEMA, projecting the CNMI to reach its peak of the pandemic by mid-May, Governor Torres feels if everyone does their part in practicing social distancing and staying home, the curve could be flattened.
So there's a peak, there's a trajectory that was offered, that was proposed a couple of days ago with FEMA. It shows a high peak by mid-May, roughly May 20 that week. And if we follow that trajectory, that's when the highest peak, and then of course it's going to drop down. Again, if we follow that model, that means we're not listening to social distancing, we're not following what is being advised across. If we all do our share, then we can flatten that trajectory and have less casualty and fatality on the island.
Muñoz says they are projecting to start COVID-19 testing at CHCC next week. Reporting for KSPN, I'm Ashley McDowell. A letter was sent out to PSS employees informing them they will be furloughed for the next 12 months. KSPN speaks with PSS Commissioner Dr. Alfred Atta about the tough decision to furlough PSS employees. The Commissioner of Education of the CNMI Public School System, Dr. Alfred Atta, has made the tough decision to furlough PSS employees because there is just no money.
It's been a very, it's been a hard day. I knew the day was going to come, but you won't know until the actual day actually arrives. And it has a lot of emotional, toll with it, but hard decisions are hard decisions, and so we try to get past the emotion piece, and we know that things are going to be better if we make the sacrifice.
Commissioner Addis says the furlough is scheduled for 12 months, but that could change depending on the turnout of the coronavirus as the year progresses.
When we say 12 months, that's the cushion. That will give us that time, space to plan accordingly. I feel that if we do it that way, we're comfortable in coming together and come with a solid plan when we're ready to open. Plan A is if we're still in shelter in place, we will expand the learning at home packet and distance education more. enhance it and then provide that learning enhancement to the community. Plan B, if they lift the COVID-19 and we have that we're safe to come out, then we will go as scheduled. That calendar has already been out. We will open in September, right, the day after Labor Day. So that's the plan so far.
Learning at home packets have been distributed this week to students to finish out the remainder of the school year.
So the third quarter grades have been already was calculated and posted. Now for the fourth quarter, for the schools that are doing fourth quarter, what happens is it's a pass or no pass a grade. So that's where they're at. Well, that's where we're at with that. For the high school, it's a different story. We have to get the students' work back, but both through online and through paper, so that we can grade them and post them, because it's a numerical grade. It's not a pass or a no pass grade, especially with the high school seniors. It's very critical that we get those numbers in and justify. A lot of it has a lot to do with like the ranking of top 10 and who will be the class valedictorian and salutatorian. So right now, the principals and the counselors, high school principals and counselors are staying through the furlough. Their furlough effective date is on June 15th, because that is the actual date that school ends for this school year.
Commissioner Addis says the teachers will be receiving the back pay as soon as funding becomes available.
I'd like to make that clear, that we are working really hard we have to pay back first the 30% that we owe them, then this last pay period, 100%, and then this upcoming pay period, we have to pay them at a 64-hour rate, 64 hours instead of the 80 hours. Now, this is just for the locally funded personnel. The federally funded staff, they're set. They don't have any financial setbacks in regards to the furloughs.
KSPN also speaks with a PSS teacher who is affected by the recent decision. I know you guys, the PSS employees, received a letter this week stating that furlough is happening. What did the letter say that was sent out to you guys, and who did the letter come from?
So the letter was addressed to each individual PSS employee from the Commissioner of Education, Dr. Alfred Epta. And in the letter, we were informed that beginning April 15th, furlough would be enacted for 12 months. So that's 12 months without salary pay. And however, the furlough means that contracts will automatically be renewed, so that when they can pay those roles again, the job will be waiting for folks to come back. And then it was also suggested in the letter that if you don't plan on returning or you find other employment, to send a formal resignation to HR as soon as you can. And that was about it. There was about 50 locally funded employees that were not included in this current furlough to continue working on learning packets, is what it said. And those 50 will be furloughed at the next stage, which is middle of June, so 2 months from now.
What does this mean then? School is going to be starting back up again for the next school year. What do they have plans for the students if all these teachers are going to be furloughed?
I think that's the important question. If we read between the lines, because I think the initial response, which is fair for so many, is just livelihood, right? Like, what do we do now? And everybody's kind of scrambling to try to avail whatever services they can. You know, the pandemic unemployment insurance, NAP. There are some rental insurance programs through, or rental support programs through like CARI-DOT through the diocese. So people are looking into how to take care of the families. And at the same time, you know, what the 12-month furlough really means is that whatever staff is not furloughed, or whatever federally funded employees they have, you know, we could, I guess, in other business terms, you could sometimes call it a skeleton crew, right? But so whatever that small group is gonna have to find a way to run the school district next year.
What is fears of the teachers with this?
So there's one thought that's been shared by a couple of people that I think is a valid point. It's not necessarily my personal feelings right now, but you know, is it fiscally responsible that they went basically 2.5 pay periods hoping that they'd be able to pay and not putting teachers on furlough yet, and instead, you know, just building more debt. So they owe, because of the admin leave extending rather than furlough being put in place, there is like 2.5 pay periods that they will owe to PSS employees. So, you know, someone's made the point of, is that fiscally responsible for the school system when a lot of any aid that's coming in is going to have to go towards debts as it is, just creating more debt, right? But a lot of teachers as well, like from our perspective, it's, I know a ton of people that on a teacher's salary live paycheck to paycheck, including myself. We have an $800 rent. We have 2 kids to take care of. With the cuts that happened last year, like, we were paycheck to paycheck, no savings, 0 savings. If anything, piling on credit debt, right? So if they had, you know, I think PSS central office and the commissioner had some hope that there might be a little bit coming in, whether it be from some kind of federal funding source or from a change of heart from the governor and giving a little bit to help finish out the admin leave. They thought it was possible. And if they thought it was possible, you know, as someone living paycheck to paycheck, I don't necessarily mind that they tried to make the furlough an absolute worst case scenario and wait until it was absolutely necessary. So some teachers feel like that was handled as best it could be, and then some teachers, I think, feel like people should have just kind of known what they were facing sooner so they could just prepare for it sooner. And really, in reality, whether it was admin leave or furlough, it still amounted to 0 paychecks. One thing I want to bring up is if you're a PSS employee, in your email, you got a fact sheet, like an FAQ sheet, all about the furlough. And there's some really helpful info in there, a lot of commonly asked questions that were answered. But I just want to make clear a couple of things there. You know, as far as life insurance and health insurance, they've said that will continue to be paid. They've said, but you know, sick leave and annual leave will not continue to be paid out or accrued. Well, of course, accrued, but not paid out. But I still caution people to actually contact their healthcare provider, you know, Aetna and whether it's private or government, their life insurance policy, because just keep an eye out. You know, every couple of weeks, make sure that money is going into it. They do say specifically that they'll be paying that out, but I don't see where the money would come from. So I have a worry, a little bit of a fear that it might not get paid, even if it's their intention. So that's not meant to criticize and say that they're trying to swindle anyone. I think it's responsible for anyone to just keep track of whether or not their health insurance and their life insurance is being paid.
I received a message from you saying you're warning teachers to absolutely not resign. How do you think this is a possibility if they're not going to be making any money? And why are you asking teachers not to resign?
Yeah, so in the letter from the commissioner, it states towards the bottom, if they don't plan on returning, or if they find employment elsewhere, they really encourage and ask that they give a letter of resignation to HR as soon as possible. And what to me feels a little frustrating is there was a note about that, but there was nothing in the furlough letter about providing the resources that people need right away to start gathering for an application for pandemic unemployment benefits, for NAP benefits. Instead of offering any kind of solutions for people's livelihood in there, they remind people that they should formally resign if they don't plan on coming back. But I just really encourage teachers to think about that before they do it. If they don't plan on coming back, even if they don't plan on coming back, if they don't have a secure job, a new income, then absolutely do not resign yet. I know at least the way unemployment gets rolled out in states is that if you are voluntarily resigning or quitting a job, you don't qualify. So I don't know for sure, but just based on standards that I'm familiar with in the states, I think employment benefits if you voluntarily resign. Now, if you're resigning because you already have a new job where the funding, your pay is coming in and you're not worried about losing unemployment benefits, then sure. PSS employees can use their own discretion on that. I just really caution not to jump the gun early on if you're not absolutely sure of how it will impact your unemployment benefits.
Coming up, a special donation was given to first responders at CHCC today. More after the break.
Mom, are you sure? What about the shutters? And do you have your medicine?
Don't worry about us, love, okay? You take good care of yourself. Hi, my love. Yeah, sorry. The power went out, so I had to light up all the candles. Yeah. Yes, baby, yeah. I'm just glad our home phone's working and we're able to contact you.
Mom, are you sure? What about the shutters? And do you have your medicine?
Don't worry about us, love, okay? You take good care of yourself. Hi, my love. Yeah, sorry. The power went out, so I had to light up all the candles. Yeah. Yes, baby, yeah. I'm just glad our home phone's working and we're able to contact you.
Welcome back to the Channel 2 News. The Eland Micronesian Resort Incorporated donated 130 bags of care goods to first responders and medical workers today at CHCC, a way of saying we are in this together.
Certainly this is a time that we need to pull together, and then there are people that we need to remember. They're putting their lives in front of for the community, and these are the first responders and the medical staffs. And this is not a lot of things that we're sharing, but again, this is something to cheer them up, and then hopefully they can have a smile on their face, at least for a few minutes. And then hopefully, I'm sure they do know, but people in our island and then their families recognize that what they're doing for the community is a good thing, and then they should feel proud of what they're doing. And then we wanted to show our appreciation as a company. And then, yeah, that's the whole reason behind this small donation for those first responders and the medical staffs.
The Office of Vocational Rehabilitation has temporarily closed their offices in response to COVID-19. The suspension of in-person services will remain until further notice, but a release from OVR states OVR staff will provide services by phone or email during business hours. If you are a current OVR consumer and you have not been contacted by your assigned OVR staff member, contact the office by phone at 287-6548 or by email at maryann@ovrgov.net. Also, if anyone is seeking disability employment resources or information about OVR, visit ovrgov.net. OVR states they will be working with DOL WIOA regarding the Pandemic Unemployment Assistance Program and will provide more details as they become available. Stay tuned, because coming your way after the break is the weather report.
We are with you. At times when you need us most, you can count on us to be there. When you need someone to talk to, when you need to stay informed, when you need to brighten your day, when you need to stay connected. We are here keeping our promise that while the world is changing, we keep working so you can keep connecting. We are your Docomo Pacific family, and we are here to help.
Hi, I'm Thelma, a certified ophthalmic assistant here at Mariana's Eye Institute. Today we want to talk to you about your eyes and how to take care of them for a lifetime of good vision.
Pink eye has a number of different causes, including viruses, bacteria, irritants such as shampoos or pool chlorine, or even allergies.
Conjunctivitis, or as it's more commonly known, pink eye, is a common infection affecting the white part of the eye. Unfortunately, this condition is very contagious and can rapidly spread through a family and a school.
Pink eye is not a serious health risk if diagnosed promptly. Pink eye in newborn babies, however, should be reported to a doctor immediately, as it could be a vision-threatening infection.
Pink eye usually lasts about 7 to 10 days, but if we put you on some drops, those drops will speed up the recovery and also protect other people from catching it from you.
Many eye issues can be treated right here on Saipan. Come see for yourself.
This has been Dr. Dennis Williams of the Mariana's Eye Institute.
My family is on whole home Wi-Fi powered by Plume.
Since we installed the Docomo whole home Wi-Fi, what did you guys notice about it?
When you pull up the driveway, it automatically connects, and I don't have to get out of my car right away and come upstairs to go on my phone.
My favorite thing is that it doesn't buffer when I'm watching YouTube.
My favorite thing is that when Addie calls now, there's no lag. Like before, it used to be where I couldn't see her sometimes and I have to hang up and then call her back, and now I don't have to do that.
You know what's a good thing too is that when you come over to visit, I could give you your own password. I can assign a time limit so that I can say that you can only be on it for 1 hour, so that means you won't get in trouble from your mom.
And then you can go home.
The thing that I love the most is that I can freeze the internet for periods of time so that we can enjoy dinner time like this. Why are you rolling your eyes? So I'll turn it back on after dinner.
Whole home Wi-Fi powered by Plume. Docomo Pacific, better together.
And here is your weather report for today. We have a high of 90, a low of 77. Humidity is 62%. Tomorrow, partly cloudy in the morning with isolated showers later that day. East winds 10 to 15 miles per hour. Tomorrow we'll have a high of 88, low of 78. Seas 4 to 6 feet. High tide at 4:28 a.m. Low tide at 10:39 a.m. Sunrise at 6:02 a.m. and a sunset at 6:32 p.m. Thank you for watching this Wednesday edition of KSPN2 News. Have a great rest of your evening.